NCLEX preparation. Most of the questions will be coming from nursing process. Let's see how the nursing process work on each questions. The first thing we are going to look at assessment of a patient. Here is the first question. The nurse is caring for a client in the emergency department who present with a complaint of fatigue and shortness of breath. Which physical assessment finding, if noted by the nurse, warrants a need for follow-up? Option 1. Redness, sclera of the eye, dry flaking on the scalp, a reddish purple mark on the neck, a scaly rash noted on the elbow and knee. The nurse is going to use her nursing skill, which she is going to use analysis to understand the problem, or else it is her cognitive ability to understand the problem by doing a analysis. We can look each of the option. The first option was redness of the sclera. The second one was flaking on the scalp. The third option was purple discoloration of the neck. The last option was scaly rash noted on the knee and the elbow. What is most concerned about this person? The test taking strategy. Note the strategic word, need for follow up. Also focus on the data in the question and select the option that indicate the most concern and is indicative of abuse. Remember that battered persons often present with bruising around the eyes or on the neck. Clinical judgment made by recognizing the clues in the question. The answer for this question is a reddish purple mark on the neck, because here the patient is screened for abuse. A battered person experiences bruises especially around the eyes, red or purple mark on the neck, sprained or broken wrist, chronic fatigue, shortness of breath, muscle tensions, involuntary shaking, changes in eating and sleeping, sexual dysfunction, and fertility issues. By this understanding, we are going to conclude the client need as safe and effective care environment. The priority concept is the communication and health promotion. The question is from mental health and it is the violence. Mental health problem can also arise, including post-traumatic stress disorders, nightmares, anxiety, uncontrollable thoughts, depression, low self-esteem, and alcohol and drug abuse. Reddened sclera and dryness on the elbow and flaking on the scalp do not pose an indication of abuse.